It is Wednesday. This is Winning Wednesday. And tonight, guess what? We have a topic, deep vein thrombosis. We will be getting into that. Lots of great stuff coming up for today. Let me make sure. Yes, sound is good. Everything is good. So happy that you're joining me. Let's get into what you need to be looking out for. Do you know the things that we have coming up? I always want to start with this because you may not have it. It is the V2 app. So if you have an account in my V2, my NCLEX V2, my nursing school V2, you should absolutely have the app. It's free and it's a quick way for you to get inside your account without having to use Safari or Chrome. Go ahead and just get inside of there. And then when you are inside of the V2, you can do the 30-day challenge. It's already inside of the course. So as you are going through your daily study calendar, check out those videos that are a part of the 30-day challenge. They're there to help you. So 30-day challenge is always there. If you want the emails that come from me, though, directly, you can sign up for the 30-day challenge at remarnurse.com/30 days. That's there as well. More great things, the YouTube events. About 50% of you watching today, you watch, but you have not subscribed to the YouTube channel. So do me a favor, subscribe to the YouTube channel. Make sure that you have hit that, smash that subscribe button so that you can subscribe to the YouTube channel, because it is a way for us to know where our audience is, I just left the Travel Nurse Bootcamp. Did you attend the Safe Nurse Now webinar that we just had? It was so good. This was the first time where literally we were putting jobs up and nurses were like, I want that job. So we got to talk today. It was myself, Mark was there, Jesse was there, Scott was there, Brandon was there. Shout out to Team Safe Nurse. They showed up and we talked about the assignments. We talked about the mentality of a travel nurse and how you can make sure that you're connecting to the right place. When it comes to travel nursing, you always hear this myth like, oh, the travel nurse gets the worst patients. But really, the secret is the contract. So we got to talk a little bit about that. We will be doing another webinar on Wednesday. So that will be our general webinar on Wednesday. So we have a lot of webinar Wednesdays. So 7 p.m. is the Travel Nurse webinar. But next week, if you are an international nurse, we are having a special international nurse webinar that will be next Wednesday at 12:30, because our international nurses have their own types of questions. And so we want to be able to address them. So go to remarnurse.com/jobs if you are coming to those webinars, if you are coming or you want to be involved in those webinars. All right. Also, this is the one that I've been getting a lot of messages about, and I'm excited about it. I've never done this before. It's my first time. So please, this is the math clinic. It's a dosage calculation clinic. You were asking about the workbook. The workbook is here. If math is your love, or if math is a place you need to learn, next Monday, Tuesday, and Wednesday will be all math. So I have the workbook here. What I want to do is, this is coming out to you guys. I just want to go over the schedule. So on Monday, we're starting at what time? Monday, we're starting at 8 p.m. Eastern time. Set your alarms. I'm going to be right here, 8 p.m. Eastern time. We're going to be doing a pre-test. We're going to be doing rounding. We're going to be doing practice questions, and then we'll do just a lesson review. So we'll go into the V2 for nursing school, the workbook. It kind of looks like this. So we'll be doing rounding guidelines. All right. And then we also will be doing that. So Tuesday, it'll be the same time again at 8 p.m. We're going to be doing liquid calculations on Tuesday, 8 p.m. We'll be filling out the workbook. And then on Wednesday, we will be doing Kahoot game night. Now, Wednesday will be our regular Wednesday, so that'll start at 9 p.m. So next week we have 2 8 p.m.s and 1 9 p.m. Yes, 2 8 p.m.s and 1 9 p.m. So Wednesday will be Kahoot. It will be a chance for you to play for prizes, cash prizes, and all of the Kahoot questions will be math. It'll be math stuff that we went over for those first 2 days. So get excited. Get excited. I'm personally excited about math. All right. So this workbook is coming. This is my instructor's workbook, but you will get a workbook if you sign up. Did you sign up for it? Let me show you how to do it. It's easy. Go to remarnurse.com/clinic. Okay. /clinic. And we'll be doing dosage calculations, which let me tell you something. Dosage calculations, no joke. No joke. Show up for class. So today's topic is DVTs. DVTs are found in Quick Facts. If you have the Quick Facts for NCLEX, you know this is my favorite book here. It is in here. Somebody tell me the page. Let me see what else do I have on here. Any other things? Oh, really quickly, while you guys are looking at Quick Facts DVTs, I also want to shout out the YouTube events for our nurses in Africa. Come on to your event. This is a partnership. It's a collab with Kenyan Nurse Consultants and Remar. We have a live YouTube. You can watch it even if you're not there. You can still watch it. It'll be Sunday, January 26th at noon. Sunday, January 26th at noon. So I'm looking forward to that. And again, Safe Nurse Now. For those of you who will be coming to our Wednesdays, we're going to have more job opportunities from Safe Nurse Now. Check out this one and let me know. You might be in here and this might be the job for you. Just let me know in the comments. Let me check it out. Here's the job. Let me see what we have here. Okay. Boom. What about this one? This is the one that we had spotlighted today. And there were a lot of people that were interested in this one. Maybe 2 people, I think, were interested in this one. We have a registered nurse job. So we have RN positions here. This one, one is an oncology infusion. So that is a specialty. And that's day shift. And so because it's an infusion position, you have 8-hour shifts. So that's 5 days a week. You're looking at a 40-hour job. All right. And your weekly gross will be $3,200 per week. Love that for somebody. And you know my jam, telemetry. We also have in Massachusetts, we have a registered nurse night position, 48 hours guaranteed per week, weekly gross $3,500. Now, you know, Safe Nurse is 4 nurses. It's 4 nurses. And so in these contracts, when you sign the Safe Nurse Now contract, even if it says 48 hours per week, but say the hospital has a low census and they send you home, guess what? You're still getting paid for whatever shift that you get sent home for. Come on. And it's just little things like that that make Safe Nurse, it makes us different. This one, Niagara Falls, New York. We had nurses actually in New York, and this was a great one for travel partners. So if you have a travel buddy and you want to go on assignment together, you can go as CNAs, you can go as LPNs. I think RNs too, I might be, but there were multiple opportunities here at this one. Let me just spotlight it for those of you who want to check it out. Look at this. There's multiple CNA shifts, 40 hours per week, making $1,000 per week as a CNA. You and a buddy can go. Or if you're an LPN studying for an RN, tap in. There's day shift and mid shift. All right. And this is an opportunity for you to go up there, make the money, study for your NCLEX, and get paid all while you are doing it. So this is how Remar is expanding with our partnerships, Safe Nurse Now. I'm really, 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 really happy to be in this space because there's nothing like it. There's nothing like this going on where you have NCLEX prep plus amazing job opportunities for our nurses. So I said this because this was really blowing my mind. This is the paycheck of an LPN that is working with us right now. And you can see for the time from December 28th to January 4th, this individual made $4,219. And so when I say think big, I'm saying think big. This is 1 week's time, okay? That's rent. That's a brand new car note. That's, somebody else's rent, somebody else's car note. $4,000. I mean, some people don't make that in a month, or some people don't make that in 2 months. Some people don't make that in 3 months, and you have a safe nurse who has made it in 1 week. So come on, what are y'all trying to do in 2025? Trying to do in 2025. So we're going to get into our topic because, hey, this is what it's about, getting you to the next level. Nurse Brooks says, what book should I buy? I'm due to take my NCLEX PN at the end of this month. Okay, so typically what I say is that buying one book is okay. Buying one book is okay, but I would love for you to have all of your bases covered. And so that means actually getting my full program, the V2. So check out the NCLEX V2 for practical nurses. This is the complete training system where not only do you get the book, but you get the video lectures that come as a part of it. So I love to talk more about it as well at the end of the broadcast so that you know how you can get started, okay? But the idea is that when you prepare for your board exam, that you're taking away all of the guessing about what's going to be on the exam. I'm just going to tell you, when you get into the V2, I'll tell you exactly what you need to know for that exam. All right, how about this? I'm a Remar RN. I did my exam January 7th, 2025. This is a fresh one. Got results January 9th. Thank you for everything. I used quick facts and watched your YouTube videos. I'm a Remar RN, sending love from Jamaica. Is that Jamaica? I want to make sure I'm right. I think it's Jamaica. All right. Amazing. Congratulations. And thank you for telling me that. International nurse, come on over. Are you signed up with Safe Nurse now? All right, I like to get you a job. Wow. Okay, so we're going to do deep vein thrombosis. I thought I saw somebody say it was on page 69 in the quick facts book. Is it 69? No, that couldn't have been right. That couldn't have been it. What page is it in the quick facts? Let me see. Where is it? Where is DVTs at? Help me. Who wrote this book? Where is it? All right, I'm gonna let y'all. For some reason, when I'm in this book, it's like, where is it? This one or is it the nursing school? Maybe it's a nursing school one. DVT, thrombosis. I know it's in here. I'm thinking nursing school. Give me 1 second. Hold on. Okay, wait a minute. DVTs, are we in here? Let me see where we at. Yes. Okay. So this is in the nursing school quick facts. This is in nursing school quick facts. So what I can do though, I'll put it up into the V2 for those of you who have the quick facts for NCLEX and you don't have this page, but we're going to go over the things that are in here. We're going to go over it as well. All right. We're going to go over it as well. The nursing school, one of the differences between the nursing school quick facts and the NCLEX quick facts is this one does have more subjects in it. And that's because for nursing school, you are required to be introduced to a lot more things. Okay. So I'm going to do an NCLEX review of DVTs. And one of the things about NCLEX reviews is that it's a review of something that you've learned in nursing school. So it's cool. Let's do it together. We're going to use the clipboard. Let me get my marker. We're going to use the clipboard to do this quickly. So deep vein thrombosis, this topic is not a new topic for you. I am sure the majority of the 700 people in here understand what a DVT is. You already know it. You've already been exposed to it. You've already been sensitized to it. What I need to do for the NCLEX part of it is help you draw to the safety principles around a patient having a DVT. So NCLEX is not a memorization exam. It is a situational critical thinking exam. So let's start here. For DVTs, here we go. DVTs. If a patient has a DVT Do we expect pulses to be positive or pulses to be negative? Which one are we going to go with? Positive pulses or negative pulses? And so this is what the NCLEX prep does. I'm not defining terms for you here. Okay, I'm not defining terms. I'm getting you to think around a patient who has this. So, and I'm glad that I'm so glad that you're here. The pulses with a DVT will always, watch this, will always be positive. Okay. Why will pulses be positive? Why will the pulses be positive? Because we are talking about a what? We're talking about a DVT. We're talking about a DVT. Right? I'm going to give y'all a second to think about that. I'm going to go to this next one. When we talk about a DVT, we are thinking about blood clots, right? We're thinking about blood clots. Are we more concerned with the veins or the valves in a DVT? Can you guys see this? And so this is why you come to class, because you won't think about it unless I put it in front of you and say, which one are we worried about, the veins or the valves? I think I got you here. Good job. The veins, because this is a DVT. So the veins tell you everything you need to know. This is why we'll always have positive pulses with DVTs, because pulses don't come from veins. Pulses come from what? Pulses come from arteries. So even if I have a blood clot in a vein, that artery should still be clear, right? So when I asked the question and I saw a lot of people saying, oh, the pulses will be negative, then I knew it's not a problem with the DVT. It's a problem with knowing anatomy. It's a problem with just knowing basic anatomy. All right, here we go. When we're talking about DVT, a risk factor is obesity or a patient being hospitalized more significant. Which one are we going to be worried about? A patient who comes in that has maybe a history of obesity, or a patient that has been hospitalized? Welcome to Winning Wednesday. Winning Wednesday, this is your study session for today. If you did not study at all, I'm so glad you came. But most of you are studying. I know that. And you know I have to come. They're like, I have been studying, but I got to come to class. Hospitalization, because those patients tend to be what? Have you ever been to the hospital before? Where's the first place they put you? It's not a chair. It's not a treadmill. The first place you go in a hospital is where? In that bed. And that is where you will remain. They're going to put you in the bed and say, this is your space. So hospitalization, immobility leads to DVTs. Which one is most related to a DVT? Is it going to be clonidine, or is it going to be birth control pills? Meaning, which medication has a higher occurrence of DVTs? Patients who are taking clonidine or patients who have been taking BC, birth control pills? I see it. You said it, BC. And when we are talking about DVTs and where they are and the feeling of a DVT, are we going to expect weakness or tenderness? Think about it. What's happening? Are we going to expect a weakness or tenderness? This is a good one today. And we are on a roll with this clipboard, and I see the comments on the screen. So many comments. We're going to expect absolutely tender. Okay? Where that DVT is, it's going to be tender. Now, is the pain going to be a sharp pain or a dull pain? This is a select all that apply. That's all. This is the question bank right here in a clipboard form. Okay, so we're going to expect, and patients will report which one is it? A dull pain. This is a deep, dull pain. It's an aching pain. for our diagnostic criterion? Are we going to have a CAT scan show us or an MRI? Which one will be most appropriate for this? Which one is going to be most appropriate for the DVT? Is it going to be a CAT scan or is it going to be an MRI? I'm liking what I'm seeing. It is absolutely going to be the MRI. The MRI is going to be able to visualize that blood clot better than a CAT scan. And then finally, our emergent situation that we are going to look out for when it's talking about a DVT. Which one we're going to be looking out more for? Is it going to be a PE, a pulmonary embolism, or a stroke? Which one is the big one? Not that either one is totally wrong, but which one are we going to be looking for NCLEX to direct our minds to? It will be the pulmonary embolism. Wow. What a great review. Very quickly, very succinctly about DVT. See, you knew it. But for those of you that may feel like, hey, I don't feel comfortable with it, guess what? We're going to talk more about it right now. This is DVTs for NCLEX. When we are presenting a deep vein thrombosis, this is one of the more common, actually the most common form of venous thromboembolisms. It is the deep vein one. And typically, we are thinking of a DVT in a lower extremity. Now, DVTs can be in the upper extremities as well, but typically for a clinical presentation, it will be a leg thing. It will be a leg thing. And when the thrombus that is located in the leg breaks loose and enters into the pulmonary circulation, then that is where you can have fatal complications, implications such as abrupt death. Okay, so these are the things to look and think about when you are studying DVTs. What else do I have here? Oh, the risk factors. Here we go. So risk factors of acquiring this particular issue is a history of immobilization or prolonged hospitalization. And I think prolonged can be subjective because we see even women, how many people have given birth before? And when you are in labor and you're in the bed for 12 hours, 14 hours, 18 hours, and then you have the baby and you're back in the bed, is it possible for young, healthy women to be in a hospitalization situation or immobilized for just 1 or 2 days and then have issues with DVTs? I have seen it after pregnancy. So that could be one of the risk factors. Recent surgery or trauma, typically within 12 weeks of surgery or trauma. Obesity was one of the factors. It definitely is a risk factor, but not before hospitalization or prolonged immobilization. And then if you have a venous thromboembolism, so you have a VTE. Other things are use of hormones, use of oral contraceptives or hormone replacement therapies. These have a coagulation potential, which will thicken the blood, cause it more likely to aggregate DVTs. I said here pregnancy or postpartum, and then a stroke or hemiplegia, immobility, that causes immobility. If you are older than 65 years of age, this puts you at risk of family history of VTEs or heart failure. So many different causes of DVTs. This is why it's something that we needed to review. And also, when I came across the subject, I said, we have been looking a lot at anatomy. We've been looking a lot at prioritization. And so I wanted to throw out these types of questions for tonight's class. The clinical manifestations that you're going to see are, we talked about, you're going to have leg swelling because that clot is going to produce swelling, a discoloration, okay? Pain, we talked about a dull pain. There's going to be some warmth and erythema at the site. How is it diagnosed? You have to look at the D-dimer. You're going to look at the patient's labs. You would do an ultrasound as well. I didn't want to put ultrasound in the beginning because I knew you would think of that. Like I knew you would get that. So a Doppler ultrasound would also show a blood clot, and your coagulation studies to also further investigate what is going on with your patient. Management, looking at a parenteral management and looking at an oral management of this situation. Let's just do a quick review. Heparin for patients with DVTs, whether it is the low dose molecular weight heparin or it is the unfractionated IV heparin, that is going to be the go-to. If you're doing an oral anticoagulant therapy, vitamin K, antagonists, factors XA, 2A inhibitors, or rivaroxaban, you need to know that medication as well. It is given for blood thinning. How do we prevent DVTs if we don't want our patients to have DVTs after surgery or during hospitalization? It is important to get them up. If you are going to be a surgical nurse, one of the biggest motivators that you will have for patients to get out of bed after a hip replacement or a knee replacement, which are just excruciatingly painful, so painful, is you will be able to say to your patient with full confidence, if you don't get up, you will be putting yourself at risk for blood clots. And that scares people out of the bed. If you say, hey, you got to walk or you're going to get a blood clot, right? That will get people up. And it's just the truth of the matter. So getting people up, leg exercises, graduated elastic compression socks, stockings, they're stockings, SEDs, intermittent pneumatic compression devices are used. And if you haven't worked surgery before, or if you haven't done any inpatient surgical care and you start on surgery, I have found that the surgical nurses are very nice. They will, they'll explain to you how to put these things on. They may put them on for your patient in front of you the first time, because these are things that really are ordered very frequently. If you have surgery, almost certainly you're going to be ordered these things. And so you have to know them. If you're going to be surgery nurses, all of my surgery nurses in the house, this is the kind of care that you'll be doing. And then thromboprophylaxis is a big word, but it just means the prevention of blood clots. So that's going to be your enoxaparin, your low molecular weight heparin, or your unfractionated heparin. Yep. All right. Part of our training, part of our studying, we do come to these classes on Mondays and Wednesdays, but when it's not Mondays and Wednesdays, you are in V2, you are filling out your workbook, watching videos, and you are also studying quick facts, these two together. And I know some people just prefer to get the books, right? But the videos also support the learning. So if something is not in quick facts, it's usually found somewhere else in the course. So get everything together for the big picture. I want you to be prepared, and I want you not to have to guess what you're supposed to be doing. One more thing I want to point out. I just saw it here. I hope I didn't move it. It's the study calendar. Where is my study calendar at? Here it is. Okay. Also, with the program in your file vault, the study calendar, this is the, even if you have the 30-day or the 90-day program, the study calendar is the same, okay? So you're either studying 5 days a week if you're doing the 1 month, or you're studying 2 or 3 days a week if you have 30 days. But this is the calendar you should be empowering yourself with as you go along. Okay, let's go into NCLEX question time. All right, rapid fire. Let's get our minds right. We are talking about DVTs. Here's my first question to you. Give it a try. A client with a history of DVTs is receiving anticoagulant therapy. The nurse notes that the client has a small amount of hematuria and mild bruising on the arms. What is the nurse's priority action? Is it number 1, notify the healthcare provider? 2, assess the client's most recent coagulation studies. 3, reassure the client that mild bruising and hematuria are common. Or 4, collect a urine specimen. Okay. And listen, I was talking about V2. These are the questions that are in the Q bank of my course. So get in that Q bank and work out your critical thinking in there. Box it out in there. The answer right here is very apparent. You have a situation with the patient. I'm asking you, what is the priority? The correct answer is absolutely number 2, assessing the client's most recent coagulation studies. You need more information to know what is going on with your patient. And this will be best that you do before just reassuring the client that mild bruising and hematuria are common. You want to make sure that you are telling the truth, because your patient might have more than that, right? If those lab values are off, you might say, oh, this is fine, right? This is fine. But then you look at the labs and you're like, oh no, this is not fine. Actually, we have to back you off of this because you have gotten too far on it. So we just want to make sure that before we're educating the patients, we know what we're talking about. So number 2 is the correct answer here. Did you get this one? All right. How about this one? A client receiving anticoagulant therapy for a deep vein thrombosis reports new onset shortness of breath and chest discomfort. During the assessment, the nurse notes a respiratory rate of 32 breaths per minute, oxygen saturation of 86% on room air, and a heart rate of 125 beats per minute. What is the nurse's priority action? Is it number 1, place the client in a high Fowler's position? 2, notify the healthcare provider? 3, assess for signs of pulmonary embolism? Or 4, apply NO2 oxygen with nasal cannula? What are we going to do? This is about safety. You know, I'm looking for safe nurses now for jobs. I'm looking for safe nurses right now for this NCLEX question, because this right here, absolutely, there's a correct answer, and it's always the priority when the answers are like this, okay? When you're presented with these answer options like this correct answer is always going to be the priority, and it is number 1. Place this patient in high Fowler's position. You can help improve the oxygenation of the patient, because that's a problem here, by essentially a position change. That's the power. That's the power of knowledge, is that before you do number 2, which many of you chose number 2. Is that right? Yes, that's absolutely right. But this question is not asking you what's right. It's asking you what's the priority, okay? You don't just walk away from a patient that is struggling and in distress, okay? When you can do something about it. You can always adjust you can always just adjust the position of the patient. That will help, right? That will help ease the breathing. And then you can call the healthcare provider. Absolutely. Go ahead and call them. All right. But what we have here is, and this is what we have, new onset shortness of breath, chest discomfort, respiratory rate of 32 per minute, oxygenation saturation 86% on room air. All right. So we do want to change this patient's position. All right. We do want to do that. All right. And if you don't know what N2O oxygen is, I'm so glad that you didn't pick it, because you don't want to pick this one. But I put it on here because I thought, like, you would see oxygen, which some people did, and they just picked it. But what is N2O oxygen? What is N2O oxygen? That's laughing gas. So watch it. Watch it, buddy. You don't put laughing gas on this patient. All right. Here we go. I'm moving on. The correct answer was 1. Correct answer was 1. Next question is this. Question number 3. A client with suspected deep vein thrombosis is admitted to the unit. The nurse observes that the client's affected leg is edematous, erythematous, and warm to the touch. All right. What is the priority nursing action? Number 1, measure the circumference of both legs. 2, elevate the affected leg. 3, administer prescribed anticoagulant therapy immediately, or initiate bed rest. I told you today I was going to challenge critical thinking. So I'm making all of these choices very important. But I'm looking for the priority. Okay? And the priority is not what's easiest. The priority is not, the priority is what is the safest thing to do. It's what's the safest thing to do. So based on the assessment, and I think that's where we're missing it. Let me say this. You are picking the answer based off of the assessment. So stay with the information that you're given here. Correct answer here is number 4, initiating bed rest. This is the priority, because what's happening here? What's happening? This is based off the assessment. Okay. You have a suspected DVT. That's number 1, a suspected DVT. But we have some symptoms here. We have a leg that's swollen, that's red, and that's warm. So we don't want this patient up, walking around, because we know that blood clots can dislodge. They can dislodge. So that's going to be the priority before measuring the leg. Okay, that's going to be the priority before measuring the leg. Do we measure the leg? Absolutely. But first we tell the patient, don't get out of bed. I'm going to go get the supplies. Okay, I'm going to go get the supplies to measure your leg. I'm going to come back. But while I'm gone, don't get up walking around. So you want to put that in place. You want to put that in place. That is the priority here. Now, guess what? I want you to get these questions wrong. You know why? Because it's better for you to get them wrong here than when you're actually on your exam. Does that make sense? So I told you that I was going to be challenging you. I told you that. That's why you come here. So if you have a situation where you have a DVT, right? These patients are in bed. They need to be in bed. And again, you have to stop asking this question. Stop asking me this question. But it should be this, because these are not questions about what's right or wrong. This is not a right or wrong question. It's a priority question. So is it number 1? Yes. Why not number 1? You would do number 1. But that is not over the safety of preventing a dislodged blood clot. Why is it not number 2? For the same reason. I mean, elevating the affected leg, that I don't know how, therapeutic that's even going to be, right? If we have a suspected blood clot. So that is not the priority either. The priority is going to be telling this patient, don't get up. Okay. All right. Telling this patient, don't get up. And so one of the big things for us to be doing while we're evaluating is just, when you see something and it makes sense to you, try to take hold of it so that when you see it again, you can recognize it. Okay. You can recognize it, because when you want to kind of like dig your heels down into a wrong answer, then your brain is going to remember that wrong answer more than the right answer. All right. One more question, and then I'm gonna let y'all go. Because it's like today is a tough one. Question number 4 is this. A client with a confirmed diagnosis of DVT, okay, in the right leg reports sudden pain and a feeling of tightness in the calf. The nurse notes that the leg appears more swollen than the previous assessment and is cool to the touch. Which condition is most likely causing the client's symptoms? Is it number 1, peripheral artery disease, 2, venous insufficiency, 3, compartment syndrome, or 4, cellulitis? And so right now you're doing a great job because you are focusing on what you're given and you're focusing on that abnormal assessment. And the abnormal assessment is going to lead you to the answer. Okay? It's going to lead you to the answer. And this is how it works. This is how it works. And this is appropriate for you to be thinking about because even if you haven't been in this situation, you have studied all of these things. You know peripheral artery disease. You know venous insufficiency. You know what it means. You know compartment syndrome. And you know cellulitis. So this abnormal assessment is connecting you to what? Okay. This abnormal assessment is connecting you to number 3, compartment syndrome. This is what our patient is at risk for. Ooh, the patient, severe pain, tightness, increased swelling, and it's cooling off. It's getting cold. Cold extremity are going to indicate compartment syndrome. Compartment syndrome. And so that is indeed, we know compartment syndrome is a medical emergency. So we got to move fast. We got to move fast in all these things. All right. Today we did a quick class on DVTs, but I am happy that you came because we were able to identify some important areas before you actually go take this test. And that is what it is all about. Hey, I am coming back on Monday for our math clinic. So don't miss it. Monday at 8 p.m. I'm going to get off here. I'm going to finish working on the workbook. I just have like a couple more things and I promise I'm going to get it out. If you did not sign up for math clinic, please do so. You can sign up by going to POW right here, remarnurse.com/clinic. Now, this might be the last opportunity for you to sign up for it. If you forget, then that's going to be bad. That's not going to be great. So come on over and make sure that you sign up for that math clinic because this is actually a three-day event. This is a 3-day event. And listen, I know today was tough. Don't be beating yourself up for today. All right. Because I'm going to do this again. I'm going to just keep going in until the test. Because these types of questions I love to write. I could do this all day long. So I want to do right before we leave. I want to do some just quick questions and answers for those of you who have general questions about NCLEX, about jobs, about the program. Those are the types of questions I want to take. I don't want to do account things right now. So if it's something specific about your account, like where's my book or something like that, please email support@remarreview.com for that. All right. For that. Also, I wanted to go into the, just pull up the program so I at least can have it in front of me if you have questions about that. All right. So questions about general NCLEX, how to study, test anxiety. I want to talk about this. Let me talk about this NCLEX fear because I want to address somebody who has anxiety or fear about the exam, because what I see happening is that somebody starts off knowing that they have to take NCLEX, and NCLEX is a big test, right? But then that awareness of the test becomes a fear of the test. Watch this. And then because the fear of the test is not dealt with, it moves from just the fear of NCLEX to just being in a state of fear, period. Okay? That's somebody where it's gotten bigger than NCLEX and you're just afraid now in general. And what I see the issue with that is that when we can't just be fearful, because being fearful of the unknown is something that you can't reason with. Okay. So if you have a fear of the NCLEX, we can look at the NCLEX and we can study for it, and we can talk about how it's just a test, right? And you get the opportunity to retake it if you don't do well. And these are the subjects on the test. And I can point you here like, okay, follow your study calendar. We can address the NCLEX, and that's okay. However, when you just want to just hold on to that fear, I can't talk to it, because it becomes a fear of everything surrounding the exam, from the day to the exam to what if I don't pass, and it just becomes more than it needs to be. So right now I'm telling you, watch yourself, guard your mind, guard your mentality, okay? Because fear of NCLEX, if you're studying for the NCLEX and you're preparing for it, it should be decreasing every day. But if you're allowing it to grow and you're allowing it to fester, then it will just be a generalized fear that you have, or a generalized anxiety that you have, which is much more difficult to navigate, okay? All right. So that. Somebody said, "You talking to me? You talking to me?" Yeah, no, watch it, because that's how it transforms on us. Okay. All right. So do you recommend, this is a question, do you recommend using V2 for exit exams and NCLEX? Yes, I do. Absolutely. I recommend you doing the course for your exit exam, because again, when you look at the topics in the V2, they are very broad. Expected changes, diets, basic care and comfort, orthopedics. These are topics that will be on an exit exam. Okay. These are topics that will be on the exit exam. So go through, do those videos, study quick facts. You will come out like gold on your exit exam. It will be much easier. Is the study guide in the quick facts the same as the one in the vault? No. So the study guide in quick facts is different. The one in the vault that you're talking about, the one, let me get in there. The one in the vault that you're talking about, this file vault, when you go to file vault and you go to course resources, this is the registered nurse one, but I think it's in both of them. You're going to get quick facts for next gen. When I pull this one up, no, that's not the one I wanted. These are sheets. These are actually sheets that can be added to your next gen quick facts. You can print those out. But what I was looking for is is it the bonus section? Let me see. What's in the bonus section? No, not the bonus section. It is in, come on. It is in the new NCLEX resources, quick facts. This is quick facts right here. This one is quick facts. Let me download it, please. This one is quick facts for pediatrics. Okay, so it is a specialty one. Let me open it up. This is a specialty quick facts that I did make as a soft copy. And so it's going to focus more. Oh my goodness, look at the baby. It's going to focus more on pediatrics. So there's topics in here: asthma, bacterial meningitis, bronchiolitis, celiac, cerebral palsy. All right. So it's just a quick book. It's 23 pages. So that's it. All right. What is it? I'm not afraid of the test. Is prep before school, the math. Yeah. You know what? And it is something that you're learning. And I think a lot of nurses can admit that we're not math buffs. It's not something that like we enjoy, but we get through it. We get through it. Okay, hold on. I test the 25th. Okay, so that's like next week. I have read my quick facts like 5 times. My V2 just got expired, but I have reviewed for my V2 workbook. Perfect. Now my problem is the test anxiety. Yes. But here's the thing about it. You have done, and I'm going to talk more about this, and I might have to do another workshop, but you have done the work. Obviously, you read quick facts like 5 times. Most of that test is going to be the diagnoses and the information in quick facts. The V2 workbook just helps you see the big picture. So you have literally everything you need. Let's talk about that. Let's talk about you have everything you need to pass, honestly. But you do have to control your emotions. And don't allow test anxiety, which is anxiety is an emotional response to, it's supposed to be to a thing, to a real threat. You're having an emotional response to a test. Okay. So let's talk about that. Let's talk about the emotional response that you're having. Are you going to let this rob you of your future? Okay. Or are you going to decide that I am going to control my thoughts, and this is why I say scripture is so important, because when you focus on the scriptures, you take the focus off yourself. Okay. You take the focus off yourself. And I think that's something that would be helpful, because you've already done the work. Okay. You've already done the work. And did I say that the percentage rate of this NCLEX passing is like 90%? Are you in the 90%? Absolutely. Absolutely. Okay. All right. You got this. You got this. All right. You having a miscommunication with the emails? Okay, send an email right now. Okay. I'm new here. I start school in May for LPN classes. Do I need to purchase all 3 books, or which books do I need to purchase for my LPN program? Okay. So for you, I would say do this. Let me see if I can do it. For you, I would say do this. I would say go to my website, because you don't start classes until May. So you got so much time to be ahead. Girl, you want to do nursing school before nursing school? Go to my website, remarknurse.com. And what I want you to do, let me move this other way. What I want you to do is you can keep coming here, no problem. But we're getting ready for school in May. So I want you to go to remarknurse.com. And in this section right here, it's called nursing school. Nursing school. So I want you to click on nursing school, and you are going to start taking your classes. Okay. You're going to start your nursing school before nursing school starts, so that while everybody else is super confused and feeling like they are struggling and rushing with fundamentals, because that's the first class you're going to take, pharmacology, you're going to do clinical math, you're going to have all of that done. All right. And you're going to go in there and you're going to get the V2 nursing school. All right. And you know how much a year of nursing school costs? Like, to get all this information, let me tell you, $39, or you can do it for $99. You probably want to get the year review, right? You're going to do your first quarters, semesters in nursing school before May. And then when you go there, it's going to be a cakewalk. And people are going to be like, how does she know? How does she know? Right? It's because you did the nursing school V2. All right. So I would say at least get in there and do the fundamentals, watch those videos. That's going to go over your legal aspects of nursing. It's going to go over developmental milestones. It's going to go over critical thinking, client education, all those things. Okay. So thank you so much. All right. Okay. Where are we? I got so many comments. I don't know. Somebody's like, read my comment. Where's your comment? Where's your comment at? Oh, you can also use the code NURSET for a discount. So coupon code, write this down. I'm trying to help somebody out. Okay. NURSET has a discount code. When I purchased the V2RN NCLEX book, will it be posted to me in the UK? Yes, we ship globally. So you're going to actually get the physical book. Make sure you get that physical workbook plus quick facts. Okay. So you should get 2 books sent to you in the UK. What else? Need help selecting questions for the test bank. Let me know what you mean by that. You need help selecting questions. Quick Facts ebook. I don't have one. That book is a physical book for good reasons. Okay. Thank you for mentioning the file vault, seeing many new things. Absolutely. The file vault and the discussion board in the V2 are certainly good resources. Can we do more of case studies? Yes, we can. It will be a different format, different presentation. I will be doing case studies for February. You know, my event in February is Love Your Content. And so that's a 2-day pregnancy STD lecture. I'll do, those will be case studies. Okay. Hey, Remar for NCLEX RN year 2022. I like this. This was a generation. Your content is a blessing. RN in the house. Hey, RN in the house. I need the nursing school V2. Nursing school V2 is doing so well. I'm so excited about having that new course here. I'm recording the mental health videos now for it. So I'm really excited about just finishing that. Okay. All right. So what happens whenever you go to create the test? It won't unless you take the entire question. So let me do. Let's go into the question bank because I'm not sure what you mean when you say that. Okay. How do you select questions for the V2 bank? Okay. Let's do that. Let me go back to the V2. Let me find it. Okay. So let me go to the home screen so you know exactly where we are going. We're going to go into the V2 question bank and look for the question bank. Okay. So when you first enter the V2, what you're going to see is all the videos, and that's great. I want you to start watching the videos when the book comes. When you go down to the second icon here on the side panel, your control panel, it'll say question bank. It'll tell you all the questions in the Q bank, 3,296, how many questions you've taken, and then how many are not taken. And then it'll say correct answer, partial answer, incorrect answer. I think I'm using Google Chrome right now for this. So here we go. All right. So when you go in, you have to always name your test. So Regina test. Okay, you have to name it. Then this is where you pick tutor test or computer adaptive test. Okay, so you can pick what you want. I'll just say a tutor test. And you can pick the difficulty level, easy, moderate, or hard. And then you can also pick what subjects you want to do and then what lessons you want to do. So if your school uses ATI, this question bank is very much like that. This is the dynamic portion of the V2 question bank. So you can pick the types of questions that you want to do. If you want to do certain topics, if you want to do next gen, all right, that's it. And then you can pick the number of questions you want to do. So let me just do 3 questions here. I don't know what I'm going to get. It'll be random 3, and then I'll do a time. You should be trying to do questions for answering questions in 1 minute. And then it'll create the test. And here is the question. This is I think I picked pharmacology. So it's just select all. And this is tutor. So you can check your answer right away when you do tutor. And go to the next question. Read the question. Check your answer. Okay. And then if it's right, it'll give you the rationale. If it's wrong, it'll give you the rationale. When it's a tutor test, it goes right after that. And then that's it. You're just clicking and then checking answers. Okay. And I can't believe I got 2 right because I didn't even read the question. So this is how you create questions, and you can do it. It'll tell you what your results are. You can view your test results right here. Okay. And so this is how it works. All right. So that's the question bank. And like I said, you can make as many questions as you want. You can go in here, and as long as you name it, all right, you can name it. If you do the computer adaptive test, though, you should get, you won't be able to do any of the options. And you literally, when you try to start the test, it's going to tell you, all right, it's going to tell you the CAT test is a 5-hour test. You'll get a pass or fail. And it just means that the test will be a 5-hour test, but it may cut you off before that if you pass it or fail it. Okay. And then so you'll have to verify that you want to do this, because once you start the CAT test, you cannot pause it. So my CAT test acts just like NCLEX. All right, guys. So this is something that you can do if you're doing your study calendar. You can do it after you watch the lecture videos or not. Okay. All right. Let me go back here. Oh, you know what? Okay. All right. So that's it, guys. I do have to go. My camera died. So that's it. I got to go now. And I hope that you have understanding. If your school uses HESI instead of ATI for the V2, does that matter? No, the content's going to be the same. I'm shocked. I guess some schools are still using HESI, but yeah, so that's it. You can still use it for even that. All right. So good luck to everybody. I will be back on again on Monday. So if you didn't sign up for the clinic, please do that. The link here again is remarnurse.com. /clinic. So I'll see you guys later. Bye-bye.